Hello everyone. So here we will talk regarding the food poisoning. So food poisoning is actually acute gastroenteritis that is caused because of bacteria or its toxin or the chemical substances or the plant or animal poison that contaminate our food and then we consume it, that leads to food poisoning. Now here we have a common points that there will be a cluster of patients who will present with similar sign and symptom and will have a history of ingestion of same food. Okay, and this food poisoning is generally a, if it is an epidemic, it will be a point source and a single exposure epidemic where we will see a single wave. Okay, and most of the cases will lie within a single incubation period. So here we will talk about these five type of food poisoning. Going on with the salmonella, it is generally caused due to Salmonella typhimurium, enteritis, or cholera suis, and the source is generally an animal that is already having salmonellosis. Okay, and when the person consumes a meat or meat product or milk product contaminated with these animal, okay, so the patient gets this kind of food poisoning. Also rats and mice through their feces and urine are important source of this food poisoning. Incubation period is around 12 to 24 hours, and these salmonella infect our intestinal cell, leading to enteritis and colitis. And this inflammation also leads to a sudden onset of fever, nausea and vomiting, and watery diarrhea due to enteritis. This case resolves generally in 2 to 3 days. Talking about staphylococcus aureus, here the agent is an enterotoxin rather than a bacteria. The important thing is these enterotoxin are heat stable, which resist boiling for around 30 minutes. And these staphylococcus, their source is ubiquitous, means they are found everywhere, even in as our skin flora. Okay, and one more source was when cows who had mastitis, their milk was used. Okay, so since mastitis is caused by staph aureus, the milk was rich in these bacteria, and then when milk was stored, the toxin was formed, and consuming this milk led to staphylococcus induced food poisoning. Now because this is because of a preformed toxin, the incubation period is short, around 1 to 8 hours, and the toxin acts on CNS as well as enteric nervous system, leading to classical vomiting, abdominal cramps and diarrhea. But contrary to the case of salmonella, here fever is a rare feature. Talking about botulism induced food poisoning, the first point is it is the most deadliest, and two-thirds of the patient suffering from botulism die. The two important point is heating the or cooking the food at 100 degrees Celsius before eating it can prevent botulism. Plus, guanidine hydrochloride is an important drug that prevents the binding of these toxins to our central nervous system. Okay, so this botulism is also caused by an exotoxin, that is a botulinum toxin type A, B, and E, and these toxins are generally present in preserved food like the canned vegetables, canned cokes, diet coke, whatever that, smoked and pickled fishes, and homemade cheese, because these are the products that contain low fatty acid and accumulate the botulinum toxin. Now here the incubation period is around 18 to 36 hours, and the toxin majorly affects our nervous system. So here we see mild GI symptoms with a, since presynaptic neurons are affected and the acetylcholine is not released, there is decrease in parasympathetic activity, and this decrease leads to muscle paralysis in different areas, which may manifest as diplopia, ptosis, quadriplegia, and death generally occurs in 4 to 8 days because of respiratory failure or cardiac failure. Talking about the fourth kind, that is due to Clostridium perfringens, the special point is that this poisoning lasts for less than 1 day, and no mortality due to this bacteria has been reported. Now, in a case of food poisoning, now this type of food poisoning has a classical history that there will be a cooked food that is left at room temperature. Okay, not cool but left at room temperature, and as such for 24 hours, and after putting the food as such for 24 hours after cooking, the person consumes that food after heating it. What this does is that the bacteria grows spores over that food, and by heating, bacteria though may be killed, but the spores survive. And these spores that are left form alpha and theta and other toxins, which will lead to the manifestations of diarrhea, cramps, vomiting. Generally, lower GI symptoms will more in the case of Clostridium perfringens. Talking about the last case of food poisoning, that is because of Bacillus cereus. Okay, these are the bacteria that are ubiquitous everywhere and are found in soil, raw and dried processed food. Okay, so these cases now are increasing. There is a spike seen in the cases of food poisoning due to Bacillus cereus because of increase in the consumption of processed and dried food. Now these spores survive cooking. Okay, this is a point that we should remember. Eating a processed food and spores surviving cooking lead to this kind of food poisoning. And here there are two toxins that are formed. The one is emetic toxin and the other one is diarrheal toxin. Now emetic toxin shows sign and symptom early within 1 to 6 hours, which is its incubation period. And generally there are upper GI symptoms like staph aureus, means nausea and vomiting will predominate over diarrhea. Whereas in the case of diarrheal toxin, the incubation period is longer of 12 to 24 hours with major symptoms of lower GI, that is diarrhea, resembling a Clostridium perfringens. So this is what we needed to remember about food poisoning. Now last advice is that whenever we store food for preventing food poisoning, this zone 10 to 49 degrees Celsius is the danger zone where bacteria proliferate. And we should remember that refrigeration should be done at less than 4 degrees Celsius, because this is the temperature where bacteria are bacteriostatic. Okay, so this is what we needed to remember about food poisoning. Thanks for watching.